So now we're going to move into treatment. So we'll start with prone. So as usual, you're going to start through all the 3 stages of treatment, starting with adaptive. Adaptive stage can be a combination of circular wiping, MOFA, or TWIFA, pressing. And you're going to focus mainly on the areas you're treating. So upper back, scapula, trapezius, stuff like that. Next, we are moving into Gunfa, rolling on the upper back. So remember, you want to roll across the fibers. Tony's incredibly ticklish, so he's being super stoic through this whole thing. Next, we're going to move into Anfa and Yafa. So we're using our elbow for this one, and we're going to go in the Huato Jaji points, starting with shoulder, because with shoulder, a lot of scapular problems happen because of lack of movement in the upper thoracic spine, so we want to mobilize the thoracic spine. So again, I'm going to use a flat elbow, not a sharp elbow, because a sharp elbow he'll jump. See, he just jumped, so we're using a flat elbow, and we're going pressure in. If you want to get a little bit more intense, you bring the elbow up and work with the tip of the elbow. Again, we can do splaying the thoracic erectors outward by rotating in and pulling towards the midline. So I'm rocking towards the midline. So again, we've got MOFA, TWIFA, Gunfa, same kind of stuff. We're working into Yafa and pressing. Next, we're going to go to Gunfa and Rofa. We're going to alternate them. So using 2 hands is the best here because you cover more territory. One hand is going to knead, one hand is going to roll. Now that we've cleaned that up and that's a little bit looser, we're going to move to Anfa on small intestine 11. This can be pretty intense, so be sure that your pressure is gradual, not too sharp. So going in, just pressing here. As you remember, this point treats a lot of shoulder pains, just like large intestine 15. Next, we're going to do Tambofa across levator scapula. In this case, you're using thumb on thumb or index finger, whatever's comfortable, and you're doing a plucking technique across the fiber. Okay. Next, we are moving to Anfa on the medial border of the scapula, so we're treating the posterior rotator cuffs here. Thumb and thumb, coming in, and pressure across. So just work from the tip of the scapula right to the glenal humeral joint. Okay. So ideally we'd be on a table here, but we're not. So we're going to do a push grab technique on the posterior shoulder. So we're pushing and we're grabbing. And as you grab, try to lift the actual joint off the table. Okay. We're going to do Anfa on the subscap. This is really strong too, so be sure to go slowly. You're going to slide your thumbs under the scapula and press up superiorly to treat the subscapularis. And lastly, again, not ideal because we're on a table, we're going to do rotation Yafa. So we're rotating the entire shoulder complex really. And that is prone.